Good evening, Big Sky, Gallatin County, and viewers from around the country. I'm Joe O'Connor, editor for EBS newspaper, and this is the latest installment of the Big Sky Town Hall series brought to you by Lone Mountain Land Company and our publisher, Outlaw Partners. We started this show in March of 2020 as a way to bring you, our readers and audience, the information you needed from the ground as COVID-19 spread across the globe. And here we are. August of 2021. Many of us thought we were out of the woods. We began to emerge from our homes this spring and summer and beat back the pandemic with testing, vaccines, and a fierce resilience. And then things changed again. The Delta variant has reared its head and is threatening to put us back to a place none of us wants to go, back into isolation, fear, and confusion. This morning, the Pfizer vaccine received full FDA approval. At a basic level, we all invariably want the same things: safety, shelter, food, to work and to live together peacefully. We want our children to be safe and to get the best education we can give them. So, why are we politicizing a dangerous virus? Why are we at each other's throats over masks and vaccines? We're neighbors. We're teachers, we are firefighters and police officers, we're doctors and lawyers and such. We are human beings and we need to start acting like it. Tonight, we aim to sift fact from fiction, to answer questions based in reality in science. And we want to give you the opportunity to ask the important questions yourselves, which you can do in the Zoom chat or on Facebook comments. We've got a great panel tonight. Jason Moore is a PhD epidemiologist and physician's assistant in emergency medicine. Laurie Christensen is the new health officer for Gallatin County, recently replacing Matt Kelly, who joined us on this show numerous times. Laurie has a master's in public health from New Mexico State University. Loren Bough lives here in Big Sky, Montana, and sits on the board of Regents for the Montana University system. He's also board chair for the Big Sky School District. Dustin Shipman is the Big Sky School District Superintendent. He earned a bachelor's degree in English from Montana's Carroll College, a master's in international education from Framingham State in Massachusetts, and a master's and doctorate in educational leadership from Montana State University. Thank you all for joining me this evening. So for this format, it's a little bit different. We have three topics. First is facts about COVID-19 and the Delta variant. The second is effects on education. And the third is vaccines. We'll shoot to spend 15 to 20 minutes for each topic. I encourage the panelists to chime in with comments or questions at the end of each topic, and we'll go to the audience for any questions at that point. For you all at home, again, feel free to post your question as a comment on Facebook or on Zoom. So here we go, Delta facts. For us to have an engaging and thoughtful discussion, we need to lay the groundwork. Information based on science, on medicine, on fact. Nationally, as of last Friday, according to the CDC, there were 157,450 new cases reported nationwide, 1,120 deaths, the most in a day since March 10th, and 170.8 million people had been vaccinated. That's 51.5% of the total population. In Gallatin County, transmission is considered high. As of last Friday, averaging approximately 24 new cases a day, 173 of those active, 173 active cases, excuse me. 56% of Gallatin County residents were fully vaccinated and 31% school-age kids, which is the ages of 12 to 17. Jason Moore, let's start with you. Welcome back to the show.
Thank you. Thanks for having me, Joe.
Thanks. Jason, you've been involved with the COVID-19 pandemic from the beginning. What is the Delta variant and how is it different from the original COVID-19 strain?
Yeah, so Delta variant it's a cousin of the original, or we call wild form of COVID-19. And basically how this works is every virus ever known and even those we don't know, undergoes mutations. Okay, you know, a human generation is 50 years. For a virus, it could be a couple hours. So there's constant random mutations that happen. Most of them die off. There's no reason to keep them around, but any mutation that's worth keeping, the virus will keep and pass on, and then that will become a new variant if it's proved to be beneficial to the virus. So Delta is one of the 4 that are currently of concern in the United States. Okay, there's Alpha, Beta, Gamma, and Delta. And Delta, very simply, the Delta variant has a mutation on the spike protein, which allows it to be more transmissible or more contagious than the original or wild form variant. Okay. As far as mortality goes and some of those other questions that I know we're going to get into, there's simply not enough data right now to tell us, but we do know that it's more contagious than the wild form.
How does a variant come to be, and what are we seeing nationwide right now regarding the Delta variant?
Yeah, so you know, you have mutations that happen all the time. Some are worthwhile, some are not. The ones that are worthwhile to the virus, it holds on to, okay, and then it develops a new strain or a new variant, and that's actually what the variant is. Delta now is over, probably today it's probably over 95% of the strain that we're seeing in the country, which would attribute to the increased number of cases we're seeing, because again, as we stated earlier, Delta variant has increased transmissibility when compared to the other.
Okay, so does that mean it's more dangerous?
Yeah, that's the question, right? That's the question. And the answer is we don't know, but it doesn't look like it. Now, if we think about the goal of the exercise for the virus, it's to live, right? It's to keep going. And we do know that viruses that have a very high lethality or mortality rate, and they kill their host very soon, they die off pretty quickly, right? Because you're not around long enough to pass it on. So it actually is in the virus's best interest to have a high level of transmissibility or be very contagious, but not as lethal, because it keeps people around longer to spread it longer. And right now, we just don't know. We don't have enough information back on this one yet, but it's not appearing right now to be more lethal or have a higher mortality rate.
Mm-hmm. Mm-hmm. Is it concerning you, and I guess to what degree?
You know, you kind of set us up with your intro. You know, in this case, the politics, the hype, and the fear around it are probably what scare me more. This is starting to be an instance in which the fear is getting ahead of the data, right? So we're still waiting. We're trying to figure out exactly what's going on, especially around children, which I know we're going to talk about in a little bit. But it is important for us all to kind of keep the numbers in front of us so we actually know what we're talking about instead of allowing our minds to run. Because when fear steps in, that's when we want black and white answers. That's when kind of rational thought goes away. And that's not really how these things work, right? These things evolve over time. We learn more every day, every week, every month. And that's kind of how this one needs to go as well. So to answer your question, am I concerned? I'm concerned about all of it, but am I more concerned? Not yet.
Thanks for that. So, Laurie Christensen, welcome to the show. Let's go over to you. You heard from Jason Moore just now. 95% approximately of infections with COVID-19 nationwide are from the Delta variant. What are we seeing at the county level in terms of infections and hospitalizations in adults?
Yeah, so I would echo, in the state of Montana, we have very similar, of those labs that were sequenced for the Delta variant, anywhere between 90 to high 90s percentage of those sequenced were the Delta variant. And this is a significant change right around the beginning of July, when some of the other variants of concern were more dominant, and then this Delta variant quickly became the predominant variant here in the state as well as the county as a whole. So in terms of cases, we have seen increasing number of cases as of, and you kind of highlighted the high level numbers, but as you can imagine, that sometimes will there's a little bit of a lag, but it does impact our hospital systems. And so, with these escalations we've seen in COVID-19 positive cases, there has been an increase in inpatients at the Bozeman Health Deaconess Hospital. And in recent days, and I've been talking with Bozeman Health frequently, as early as this morning, just in terms of their capacity. And so in those conversations, they've shared with me that there have been COVID-19 positive inpatients at Big Sky Medical Center, as well as the Bozeman Health here in Bozeman. And they're seeing high numbers of individuals who are unvaccinated, typically more than 94% at times. And 100% of those admitted COVID positive inpatients have been unvaccinated. So I think that's really important to remember when we're talking about the ongoing transmission of this virus, that there is a vaccine that's available to slow transmission to others. And so they are also sharing with me that they do have enough staff and additional crisis staffing to support their efforts that are arriving as early as today to care for their patients. So I think, I definitely agree that there's more we need to understand about the Delta variant. I'd also say that it's definitely increasing the number of cases we're seeing, not just in Gallatin County, but across the state.
Mm-hmm. Sure. As it relates to things, Laurie, like masks, like vaccines, like social distancing, all of these things that we've seen, we've all been dealing with over the past year and a half. As county health officer, can you make county mandates or just recommendations?
Yeah, it's a great question. So yes, there are opportunities. And again, we always in public health, our first approach is always education and outreach. That's important to us. That's something that's a core tenet of what we do in public health. There are circumstances where an order, health officer order, or an emergency health rule is valuable to protect the entire community. In terms of specific orders, there are, I do have an isolation order in place for those individuals who are identified as a positive case. Those individuals still must stay home. There are some challenges or differences in terms of legislation that has recently been passed, where, during the course of the pandemic, we had our Board of Health adopt policy, adopt law through emergency health rules. Because of the most recent legislation, what has shifted is that the boards of health can recommend for adoption policies, and then through what is termed a governing body. And as of right now, those two governing bodies are city and county commissions. They have to meet and agree upon whether or not to adopt that policy moving forward. Mm-hmm. So the landscape has changed a bit, but the purpose of public health and why we're here hasn't. We're here to protect the community.
Mm-hmm. Sure. Well, no, thank you for that. I just wanted to kind of make that clear. I know that some things changed on the county level in terms of the county health district and board, health department and board, making some of those recommendations and mandates as early as, earlier this year, and then things shifted to the county commissions. How's that transition been for you? And do you feel confident that the commissioners have a good handle on things in terms of what the best recommendation is for the county?
Yeah, thanks. It's been, anytime you step into a new role, there's always transition, and there's always a lot to learn. On top of that, the public health system that I was really familiar with working with prior to my position as a health officer has changed, and it's learning, new laws and adapting to those laws and adjusting processes and workflows, and that can take a lot of time and a lot of conversation. So I talk to our county and city commissioners on a really regular basis. Again, I talked to a few of them this morning. So, I think it's just, it's different. and will just require a lot more collaboration, a lot more discussion, and just a lot of work on our part to make sure there's a good understanding of the importance of public health.
Sure thing. Well, I definitely appreciate that, Laurie. I know you got your work cut out. It's an important job, but I can appreciate that response for sure. Jason, let's shift back to you. I'm curious, how is this Delta variant affecting kids on a national level?
Yeah, that's the $1 million question, isn't it? So what we know is that we're having an increase in cases of kids contracting COVID-19, and that is being attributed to the Delta variant, okay? Ease of transmission, like we talked about earlier. So kids are getting it and kids are getting sick from it. What we also know is that although the rate of hospitalization is increasing in kids, the mortality rate currently is not. Okay, kids, generally speaking, are right around 0.02% chance of death from COVID-19, and that is held stable. Okay, now the increase in hospitalizations from Delta variant, are they sicker? We don't know. That's what's being teased out right now because it's all relatively new, and it takes time for the states to get the data to a central source to be looked at. Or is it just simply a matter of everyone now knows COVID, and if you're sick, that's what it is. So you're going to your doctor or hospital, whatever it may be. The general feeling, though, around the country when I talk to my colleagues is that, yep, these kids are sick and they need to be hospitalized. Although, again, as I mentioned, the death rate right now is still staying very low.
Mm-hmm. Got it. Yeah, no, that's, it's good to hear. It's tough to hear on a couple different levels, but, it's kind of why we're here. So, Jason, what can parents look for in terms of symptoms? I mean, are the symptoms the same in kids? Does it present itself in a similar way? In other words, does the Delta variant or COVID present the same as in children as adults?
For kind of version 1 of COVID, we all were focused very much on the sense of smell and taste and those kind of things. This one has a little more broader, a little more of a typical actually viral syndrome, which fevers, chills, sore throats, runny nose, those kinds of things. And also a fair amount of gastrointestinal issues, the diarrhea, those kind of things, the nausea, vomiting, especially in the little kids, which is exactly how kids present with almost any virus. Okay. So it's kind of showing itself to be more of a, as I said, kind of a typical viral syndrome.
Mm-hmm. Got it. Yeah, no, that's not surprising in some ways, but yes, good information to have. Well, guys, that's going to just bring us to the end of this first topic that we kind of touched on. I'd love to go to the audience for a couple questions. We have one here from Blythe. Do you predict a booster shot that aims to protect against Delta? And I think we could maybe hear from both Jason and Laurie on that if you have a response.
Go ahead, Laurie.
Do you want me to take that, Jason?
Oh, sure. Yeah.
Okay. As of just last week, there was an announcement that the FDA and the CDC are reviewing a possible timeline of the week of September 20th, for booster doses to be available. I don't believe they have, as at this point in time, there's no, they haven't met to discuss the dosing or the requirements, but the basis of that decision, and Jason, perhaps you can speak to the most recent data more eloquently than I can. But basically, in summary and in short, it's just based on our knowledge of some waning immunity based on some more recent studies conducted kind of across the board in a couple different scenarios. Jason, you want to add anything to that?
Yeah. So when it comes to the booster and when it comes to kind of vaccines in general, and Laurie, you actually mentioned this earlier, the reality of it is the people that are getting the sickest are the unvaccinated. That we know. And that's taking all, everyone's entitled to their own opinion, but not their own facts, right? So that's taking all politics out of it, all conjecture. That is one fact that we know. That data is across the board, is that those that are unvaccinated are the ones who are getting sicker right now with Delta variant. Okay. So the booster is an attempt, again, to move that towards a vaccinated state. Now, there are a lot of questions with vaccination. How long does the immune protection last? Breakthrough cases, all these kinds of things are conversations. But to Laurie's point is they are going to strongly recommend the booster based on the fact that what we are seeing in hospitals right now are people, primarily the unvaccinated.
No, thank you guys very much for
So
that.
I have a question for Jason.
Yeah, sure. Go ahead.
Oh dear.
Jason, question, the Delta variant, as I understand, it didn't originate in the US, was India first and maybe also in the UK before the US. What have you seen with the infection rates since they've had a longer runway? We heard a lot about India when it first hit. I haven't heard as much recently, but has there been any data showing how the Delta variant has matured in those places where it came before us?
Yes, actually there has. And that brings up a point I made earlier. So the Delta variant seems to be doing kind of what viruses do, which is, so we mentioned increased transmissibility, right? It's highly contagious, ramps up cases and then drops off, because the reality of it is, as that happens, as it gets passed around, you get increased immunity because people get sick and they survive. They have antibodies to the disease. Okay. And that's kind of what that's a very typical pattern. And that's what we have seen. The Delta started in India in October 2020. That's what we saw. Now there's other variants that are coming out that's for another town hall. But yeah, to answer your question, areas where they've had Delta, they had a spike in cases. And with that, there's going to be an increase in deaths. That's just what it is. And then it seems to drop off rather precipitously. Yep.
And so do you have an opinion about where we are, as a country in that cycle?
If we follow the cycle, we're probably at the steep, we have not reached the apex yet.
Okay. Thank you.
Yep.
Thank you, gentlemen, both for that. And, I do have another question here that I'll bring up. It's more along the lines of vaccines, but when we get to that section, I'd love to ask that question. But I'd like to move us on into education and where we are going into the fall semester here across the country, in Montana, Gallatin County, Big Sky. Loren Bough, thanks for your question just now, but I'd love if you could just tell us first, a little bit, you said on the Board of Regents, can you tell us a little about what the Board of Regents is responsible for?
Sure. Board of Regents is a group of 7 individuals who have legislative approval. It's kind of like you think of it as a school board for the state, but we have about 16 campuses around the state, and we're responsible, from our powers given from the Constitution to run the university system. And the way we approach this has really been, we were focused on the health and the safety of the students, the employees, and the communities. At the same time, we realize that what our community here in Montana wants is, high quality in-person learning. So we're in a situation where we're juggling, those two demands. And one of our approaches has been very much incentivizing and making vaccines available as much as possible on campus. There's a campaign happening right now where we can give out gift cards to students. Students arrive on campus next week. We're doing that all within the framework of also allowing the campuses to make recommendations. For instance, Montana State in Bozeman and the University of Montana, Missoula, the 2 largest campuses, have slightly different approaches to what their mask mandates are, for instance. So that's and those campuses are they're in direct communication with the Office of Higher Education, which is the executive function of our board.
Mm-hmm. Absolutely, yeah. No, that's interesting. I imagine those are the conversations you're having. Well, how do those conversations? I mean, Loren, you're also, the chair of the Big Sky School District Board. How are those conversations informing the conversations you're having at a local level?
Sure.
Yeah, just love to hear about that.
Well, I think Laurie and Jason did a great job of laying out the facts, which are the variant is prevalent and highly infectious, and it's making children, sicker at a higher frequency, probably because they don't have access to the vaccine. So, really, as we think about health and safety, my particular focus is on the 12 years and younger who are part of any of our school systems, because they're actually the group that doesn't have a choice. It hasn't been approved for them even on an emergency basis, and so our focus is what can we do to buy them some more time to avoid the illness. And when we think about the older groups, I think Laurie gave a stat about the vaccination rates countywide for teenagers, let's call them 13 and up. And as I believe it was in the 30s, I think we're much higher in Big Sky. We don't know, we can't track it, we can't ask the question necessarily. Well, we can ask the question, but they don't have to answer. But, just the anecdotal evidence from our coaches and our teachers and the nurses in the community is that we probably have a higher vaccination rate in the community. So we try and take both of those, try and take all those facts together, but with a particular focus on really the kids that still don't have the option to choose a vaccine.
Of course, yeah. The least they're the most vulnerable actually. Well, Lauren, the school board, the Big Sky School District Board, has a big meeting tomorrow afternoon. What will you guys be discussing there?
Well, again, I think you mentioned at the beginning, I was probably in the same scenario you were 3 weeks ago, coming back from a nice summer break, not really focused on the Delta variant and its implications for reopening. And so over the past couple of weeks, we've just had to get up to speed on what the dangers are. Our medical community here in Big Sky is telling us that hospitalizations are up statewide and even here in Big Sky for children. So I think tomorrow at the board, we need to do two things. We need to protect the health and safety of the students and faculty, and we also need to reflect the values of our community. So on our agenda, we'll have a recommendation about a mask mandate that will be discussed in public. These decisions aren't made before a meeting, they're made during the meeting. And so kind of like this live Zoom session, we'll be talking about it, and what Dustin will have recommendations, and we'll move forward, using some of the data that was presented here tonight. But yeah, I think our board is very much of the mindset that we need to be nimble and flexible and change quickly based on the facts on the ground.
Sure. Thanks for that. Dustin Shipman, let's shift over to you. You and Lauren work very closely together at the school. What are you expecting at the board meeting tomorrow? And do you have any recommendations for the board at this stage?
Well, I mean, as Lauren said, we're expecting a lively conversation and an in-depth conversation about what Laurie and Jason have both mentioned here today. I mean, this isn't the first time that I've sat in a meeting and been able to interact and collaborate with Laurie. This has been going on for a couple of weeks now. She's done a great job of keeping the superintendents in the county up to speed, making recommendations, providing a lot of literature, a lot of data around how we should be approaching our reopenings. We've put everything out to our faculty. We've put everything out to our school community, soliciting feedback on really where are you feeling about these, how are you feeling about coming back to school with the policies that we currently have in place. And we've really, I think, done a good job, cast a wide net seeking that feedback. So tomorrow I expect a good conversation and discussion around the things that we're talking about here tonight to try to put policy in place that keeps the kids learning, and especially those who are the most vulnerable right now, which are the sub 12-year-old group, keeps them in school and keeps the community safe while also reflecting what the community wants from the school. I forget who mentioned it. I think Lauren maybe talking about the Regents. I mean, nearly every single school district and higher ed institution in the state and probably in the country, all we've heard about now for 16 months is we need our kids in classrooms learning. So I think, as for my 2 cents in leading this conversation or being a part of the conversations tomorrow, as from an operational standpoint, is what is going to be the best thing to keep our kids in school and reflect the wants and needs of our community and the safety aspect of our entire community as well.
Sure. Not an easy one to figure out there, but I think we're all very interested to see how that goes, and wish you all the best of luck tomorrow.
You know, I mean, I would just add that this doesn't happen, you know, in a vacuum. You know, we have a group of trustees who are very engaged in the community. They're very engaged in what they do as trustees, and they're very engaged in wanting the absolute best for the students of Big Sky School District. So I feel confident that what will come out of that will tick those boxes of, you know, for nearly everybody, of keeping the kids educated in the manner that education is meant to happen, while keeping everybody safe.
Mm-hmm. Sure.
You're right, no easy task. That's why I'm especially thankful for the current board chair.
Absolutely. Well, you know, both Dustin, in your letter to the Big Sky School District community, and Laurie, in your letter to trustees and superintendents, both recommend following CDC guidelines. Laurie, you've repeatedly pointed to the CDC, whose current guidance recommends recommends masking indoors at K through 12 schools for ages 2 and older, regardless of vaccination status. You know, just to take it to the county level for a second, the Bozeman School District recently convened a task force for the future of mask wearing. What does this mean for the Bozeman schools and for Gallatin County at large?
When you ask, what does this mean? Do you mean the recommendation or what? Just for clarification.
Yeah, absolutely. Now, well, what does, you know, the CDC's guidelines, the fact that the Bozeman School District is convening a task force for this, you know, what do you see in the future for the county schools in Bozeman specifically?
Yeah, so I mean, and Dustin spoke to this. I mean, none of this happens in a vacuum. So, you know, we as public health are really connected and working as closely as we can with the trustees and superintendents to try and find the best path forward so that kids can stay safely in school. Mm-hmm. So, I mean, the CDC recommendation is really following along those same lines. And it's not just the CDC, it's the American Academy of Pediatrics that has also recommended some really specific things related to wearing masks indoors, as well as some of the other recommendations about social distancing when practical, ventilation, increased ventilation, and just ensuring that kids are staying home when they're sick, as well as all I know the staff and students and faculty have worked really hard to really encourage kids to wash their hands frequently. And all those things are going to continue to be really important.
Mm-hmm. Yeah, absolutely. Thanks a lot. Dustin, you've been navigating this pandemic with boots on the ground as superintendent of the Big Sky School District since the beginning. When school let out in June, just a couple months ago, what were you feeling then?
Well, I mean, we were feeling a lot of relief. You know, at the end of the school year, that happens every year when you reach the end of a school year. But you know, we were feeling a tremendous amount of relief at that particular time. Right, case counts in the county, case counts nationwide were going down. You know, we really kind of left thinking that we would be coming back to a much more normal with fewer difficult decisions to make going into the school year. That's obviously changed, as Loren said, you know, in the last, you know, obviously for myself, I've been tracking things all summer, looking at what other districts are doing, like what other states are doing. So, you know, we felt like kind of we had gone over that apex that Jason mentioned earlier. And now I think we're in a better space than we were a year ago, going into the school year. And namely because we now know, we know how to really react quickly and nimbly when we need to.
Mm-hmm.
Yeah, I would agree. I think our district and probably other districts around the country, you know, we learned what worked. It's easier for us to do spacing. It's easier to keep cohorts. It's easier, you know, to run that cohort model even through recess and lunches. So I think that the teachers and the staff are prepared for that. And I think what Dustin would agree with is that, guess who this is the easiest for in some ways, the changes in patterns and wearing a mask or not wearing a mask, is the kids. Kids are totally adaptable. You see them wearing the mask simply because the teacher asked them to. So I think there's more flexibility than we realize that we'll take advantage of as we start out in this new school year.
Sure thing. Yeah. Well, Dustin, you've been, again, as I mentioned, navigating this pandemic. I just want to run through a timeline that both Lauren, you and Dustin are very familiar with. So March 16th, 2020, Governor Steve Bullock at the time closed schools. August 6th, 2020, Big Sky School District Board votes for a 50-50 learning model 2 is what you called it, where 50% of the student body, is rotating in while the other 50 is out and switching and that's where I think your cohorts are coming in. December 15th, 2020, a phased adoption of learning model 3. So 100% in-person learning with an option for distance learning. Dustin, I'd like to ask you this, and Lauren, feel free to chime in afterward if you like. But Dustin, you have the technology for both in-person and distance learning options. We've seen it over the past year and a half. Did you all consider offering a distance option this fall for students who have, or family members who might have, underlying health conditions?
We'll be discussing the virtual and distance option tomorrow at our board meeting. Certainly there will be a virtual and distance option for any student who is undergoing a quarantine after being identified as a close contact or after being identified as for isolation via the county or via a positive test. So we'll be discussing that tomorrow. The trend across districts, at least small districts in this region, seems to be, special circumstances, which might include those things that you have mentioned, but certainly in those instances where a student is unable to come to school because of being identified as a close contact and or a positive case of COVID.
Yeah, that's right. I think we can add to that, Dustin, that if there's a healthcare provider reason for the student, outside of anything COVID related, of course, that would fall into those special situations where virtual and online will be available.
Oh, thank you both, gentlemen, for that. Last question I have in this section. Lauren, you're also involved with Big Sky Relief, which has been an integral group in supporting the Big Sky community over the past year and a half. What is the group's focus at this stage?
Right. Well, Big Sky Relief, which was really a wonderful collaboration in the community of some of the charitable organizations, the resort tax. Again, our focus is most importantly making sure that Bozeman Health and our healthcare providers and Laurie have the resources they need based on the facts on the ground. So one thing we were careful to do is we didn't spend all our resources in the first go round. And so if we're in kind of 2.0 Delta variant, we still have resources available. I think our focus now will be, along lines of encouraging more vaccinations, because vaccines clearly work, and responding, trying to help in terms of increasing our overall vaccination profile. But we're going to be very creative about anything else comes up. I think one unfortunate fact of this is, which maybe we should really toss back to Jason, is that Delta is not the last variant. And the likelihood of all of us having COVID exposure, over our lifetimes is almost certain. So, there'll be the Lambda variant and all the other variants coming down the road. We need to be prepared to learn from each one and to react to the facts on the ground for the next one.
Mm-hmm. Yeah, thanks for that. I'm just gonna check in with my team over on this end, see if we have any questions from the audience before we move into the final topic, which is vaccines, which you just began touching on, Lauren. But Yeah, I think Big Sky Relief really did play a major role in so many components, and just, I know this community is eternally grateful for the work that you guys did, as a larger group. So without further ado, it sounds like another vaccine question. Let's hop into what a lot of people are looking to discuss right now. So vaccines. I'd like to start, Laurie, with you. Again, I'll mention this number: 56% at this stage of Gallatin County residents have been fully vaccinated, which is similar to, I believe, the 51% nationally at this point. But last Friday, the county health department held a press conference on Gallatin County's high transmission rate. Dr. Pepper Henyon, a pediatrician with the Bozeman Health Pediatrics, said, quote, "A record number of kids are being hospitalized, and that's what's different about the Delta variant. Half have underlying health conditions, and obesity, asthma are some examples. But there are 50% of those who are healthy with minimal or no underlying health conditions." So I had this question for you, Laurie. Is this record number of children being hospitalized because of this variant, is it because this variant is more contagious than the original COVID strain, that it's actually more dangerous to kids, or is it pointing to the fact that children under 12 still can't get vaccinations?
Man, that's a good question. It's a little bit out of my medical, I don't have a medical background, so I always bring in our medical experts like Dr. Henyon to really answer those questions. So I'd welcome anything else from Jason on this one. I think what Dr. Henyon and what Jason had mentioned earlier was that, yes, we do understand that this virus is more transmissible. I think what Jason had shared earlier and what Dr. Henyon was also getting at was that there are still some concerns we have about how dangerous this is for children. It's hard to tease out if it's the variant itself or just the sheer number of cases that are now, within our childhood population. Jason, do you want to add anything to that? I'd welcome.
Yeah, that's going to be a tough one, and we're not going to have the answer to that one for a little while. But what we can say is, and it kind of, we all have batted it around, is that, it's very likely due to the increased transmissibility of the Delta variant that's making this happen. Now, the question again, which I'll go back to, is how dangerous is it? And that's the part we don't know. We know, overall throughout the course of the whole COVID epidemic, we have less than 500 true pediatric deaths from COVID out of 74 million kids in the country. So this Delta variant, it's yet to be seen how these kids are going to do. So we don't know. That's the short story. We don't know, like many things.
And the one thing that I would add to, which was Dr. Henyon was mentioning as well, and what Jason has kind of alluded to as well, is that, we do know that this virus is more dangerous for those who have immunosuppressed, immunocompromised conditions. So, in those situations where an individual is immunosuppressed, this virus is more dangerous. So it definitely can impact children with conditions similar to adults and be more dangerous in those situations, because that's what we understand about this virus at this point. Sure.
Thanks for that. The New York Times this morning, the Daily, I don't know if anyone listens to this podcast, but Emily Anthis, who was fielding questions from over 600 that they received in response to this same discussion, essentially, that we're having about COVID, Delta, schools. She quoted the American Academy of Pediatrics saying 1% of kids are ending up in the hospital, of children who get the Delta variant. 0.01% are dying. That seems like a low number, but then again, it could be the case that there are just that many more children getting the Delta variant because of its high infectious rate. But I guess the follow-up I would have for that, Jason or Laurie, maybe both of you, are we expecting vaccinations for kids under 12 anytime soon? Maybe Laurie, let's go to you. Any word on that?
So we know that basically the clinical trials are still underway. They have not released those additional trial data to the FDA. They still want to continue, especially since we're talking about a younger age group. They want to be really certain that it is safe and effective and the dosing is appropriate. And so I again turn it to Jason if he wants to add anything more to that. So as of now, we don't have any timeline that we're aware of in terms of when those clinical trials and that presentation will be made to the FDA.
Yeah, and a little more granularity around that. Part of the reason, and Laurie's absolutely right, it's going to take much longer, is because with kids we know, especially COVID, around one point, kids were less sick. We know that, the mortality rate is much lower. And when we look for all these adverse events, all these things that could happen, it takes longer because the frequency of these events is much lower.
Mm-hmm. Mm-hmm. Yeah, thanks, Jason. Thank you for that. Well, I have a question. I'd just like to give you each about 10 seconds or 20 seconds to sort of to add, to answer. I'll start with you, Jason, since we've got you right here, but people ask me this all the time, and being in the news world, I really have to think about my answer. But much of the confusion surrounding COVID-19 Delta and this pandemic is due to misinformation and disinformation. Where do you get
Joe, what are you doing to me, Joe?
where do you get your information, and where should our viewers go for the facts?
Yeah. So whether it's news or information around COVID, I make sure that I go to multiple sources. I think if you stick with one, you're going to end up eventually, just getting one perspective. And so I start with CDC. I want to know what they're doing. I look at Johns Hopkins and I look at World Health. I bounce around depending on what the topic is as well. Right.
Mm-hmm. Mm-hmm. Yeah, absolutely. Well, those are some seriously good sources to go to. Laurie, how about you? Where do you typically go?
I would echo what Jason mentioned. I would also say that we consult with our state and local epidemiologist to get a better sense of what's happening locally, and also our medical professionals as well. And then in terms of research, again, as Jason mentioned, those are a lot of the same resources that I go to. But I'm also looking for Center for Infectious Disease Research and Policy. I'm looking for MMWRs. I'm looking for a lot of different places that are peer reviewed so that we get the best collection of data available.
Sure. Thank you, Laurie. I appreciate that. How about you, Loren? Where do you turn for your information?
Well, I think on the big picture questions that are addressed nationally, I follow Jason's strategy. I try and check with as many major media outlets as possible and see if there's a building consensus. More importantly, for trying to reflect the local community, I turn to our healthcare providers here in the community. What are they seeing on the ground? How many cases? How sick? Do we have COVID cases in Big Sky? Now, a lot of times that data can't be shared except anonymously, but it's very useful. Talking to your own healthcare provider is still probably the very best way. Again, when we think about things like a mandate versus just asking your own doctor, I think that that's a very good way to get a sense of what the best decision is for you. And then the other source would be Laurie, when she can give Big Sky specific data. And that's not always the case, but we do really push her for Big Sky specific data versus Gallatin County data.
Mm-hmm. Yeah, definitely. Well, I think, Laurie, you've been doing a fantastic job where you can there. Dustin, how about you? Anything different from the answers we've gotten? Or
No, I mean, right, it would be challenging for me to become a COVID expert, so to speak. You know, we've really come to rely on our local health experts, Matt Kelly before Laurie now, because, you know, all of those things that she mentioned, she puts together and provides that information to us as a school district. There's also the National Associations of School Superintendents, National, you know, Montana School Boards Association. Those are the places I go to inform myself, and then, you know, in turn and inform the board.
Well, Dustin, I've got you on the hook here. You have a 20-year-old and a 15-year-old. You know, I'm curious when they're asking you questions, you know, what recommendations do you give them? How do you handle that in terms of similarly or differently from how you handle students within the district?
Well, I mean, I don't know. You probably don't have a 15 and 20-year-old. They don't generally come to me with many questions about those kind of recommendations. You know, I think, yeah, I've been in the same schools with my kids now for over a decade. And certainly, you know, having kids in a situation like this does influence, you know, how I look at things globally at the school district, as much as you try not to. That's just how it is. You know, I try to talk to them the same way I would talk to the students at our school. Like in this particular case, this is about getting your education completed in the best way it possibly can be completed. This is about not just about you being uncomfortable with something. This is about you being a bigger member of a community. You know, this isn't about you. This is about community, and that's the way I talk to students at school, to families, to faculty, to everybody, and the same I would do for my own children.
Yeah, thank you for that. Getting close to the end here, but Loren, many public education institutions in the country are requiring students, faculty, staff to be vaccinated. Was there ever a discussion around this possibility, and how does House Bill 702 factor into this conversation?
Sure. Well, I think the idea, you know, in Montana, again, the Board of Regents, like the school board, has to reflect kind of the wishes and desires of the community. And as you know, we're about people making good personal choices with the information they have. I would, one way to look at 702, which has gotten a lot of attention in the press, is basically what it does for the university system. It says you have to treat vaccinated and unvaccinated exactly the same. And it kind of lays that out. And you know, so if we for instance, if we have a president of the university recommending masks, then it has to be for both. You can't distinguish between those who are vaccinated and unvaccinated. And similarly, you know, with our incentive programs, we have incentives to help people make the right choices. And in fact, and I appreciate Jason's opinion on this, probably the best tool we have for increasing vaccinations is the Delta variant. You know, since the Delta variant has become public and talked about in this country, you know, vaccination nationwide is up, you know, over 100%. And I think we see similar things in Montana. So the stories of the unvaccinated being sicker and you know, having a much higher infection rate is actually your best tool to convince people to make their own decision.
Mm-hmm. And Loren, I don't know if this is best for you. I'll let anyone who'd like to field this question, but you know, what about other vaccines you know, for school-aged children, even through college? You know, what about measles, mumps, rubella that are requirements in schools? How is that different, or how is it similar that it can, you know, to the vaccination for COVID? Sure,
I can jump in on that a little bit. On 702, which is Montana specific, really prohibits, you know, a vaccine that's under emergency use authorization or anything going through safety protocol testing. So I think it will be an interesting test for the courts to determine, you know, now as we have vaccines rolling off of the EUA approval, you know, there really could be we could step back up into a situation where we could say, okay, well, this is a properly approved vaccine and we can require it now. I think that will be something that we'll probably be seeing in front of universities, Board of Regents, and the court system, in the nearest future.
Mm-hmm. Anyone else have any comments about that in terms of vaccines and requirements in schools? Jason or Laurie?
I'm going to agree with Loren on that one. I think that's coming down the pike. Once they get off the EUA, and it's going to be a matter of, that's not going to able to be a differentiator. And, those other vaccines you mentioned, how are they in the works? And, those are mandated for kids. They've been around longer. They have time. And as time goes on, that's kind of what happens. And so my guess, again, agreeing with Loren, is we're going to see that once they come off the EUA. Mm-hmm.
And the only thing that I would add is there is an exception that's built into the House Bill 702 with regards to vaccination requirements for schools pursuant to a section of the administrative rules, which basically, long story short, is that calls out specific vaccination requirements that still stand in rule. So things like tetanus, polio, rubella, and measles. Those are all still vaccine requirements. So that's just something to consider too as we move through that conversation.
Oh, good point. And thanks to all that. Those were all great answers. I appreciate that. Question for you, Laurie, now that I got you on, and for Jason as well. So, Loren, you have school age kids. Dustin, you do as well. Jason and Laurie, if you have, or if you had kids, would you feel safe sending them to school?
Laurie, you're pausing, so I'll jump in. Yes, I would. Again, throughout this, kids are at low risk of serious complications from COVID. Not no risk, but low risk. Mm-hmm. And even more so when it comes to mortality. Now, with that being said, the basics need to be embraced. Hand washing is huge. It's been big in medicine since we learned that it's actually the number one thing to stop the spread of infection in hospitals. So hand washing is huge. Masking plus minus, let's follow the rules. Let's do the smart thing, and social distancing when it's appropriate, but follow the basics. But yeah, I would send the kids.
Yeah, absolutely. And I do actually have a teenager in our local school district. And again, I would say following those basic tenets really will keep a lot of kids safe. So masking, social distancing, washing your hands, getting vaccinated when you're eligible for that. I would say that I know that the benefits for a lot of kids and being in person is important. And so there's a lot of benefits to in-person learning. There's a lot of benefits to school beyond reading, writing, and arithmetic. So I know that as a parent as well. So yes, I do feel safe sending my child to school with those other precautions in place.
Mm-hmm. Got it. Thank you very much. Well, we're kind of nearing the end here, but I'd love to ask a few audience questions. We've got some coming in. This one's for John, from John for Jason. With 94%, was it 95% of cases being currently from the Delta variant, how successful is the vaccine in protecting us?
Short story is very. Mm-hmm. Truly, I don't have the numbers in front of me, but very, especially when it comes to the Delta variant. Yeah, that is, as a matter of fact, that is, I think Laurie mentioned this earlier too, that is really who we are seeing being hospitalized with sicker disease, or people that are unvaccinated. And, I read a really good quote that, the goal of the vaccine is to prevent serious illness, not infection. And that's what we are seeing. That's actually what is happening, is those that are vaccinated are not getting as ill. Okay. They may get an infection. It'll be either milder symptoms or none at all, but it's the unvaccinated with specific regard to the Delta variant that are faring worse.
Mm-hmm. Thank you, Jason. I appreciate that. Question here from Kirsten. I'm going to direct this to Laurie for now, and we can see who else would like to chime in. I'm happy to hear multiple answers on this, but are there concerns parents should have with, say, a high CO2 levels with children wearing masks for long periods of time, or bacteria that could come in contact with the face based on these masks?
That's a good question, and we've heard it a lot. And there are no studies that I'm aware of that indicate any concerns about lower CO2 levels. Absolutely. I mean, you think about when you have something on for a long period of time, you need to change it frequently. So if you haven't laundered the mask, do so at the end of the day and get a fresh one the next day. We're really going to limit kind of any kind of concerns about bacteria and other things, as well as just encouraging frequent hand washing and not touching your mask on a regular basis. Those things will definitely help address some of those concerns.
Mm-hmm.
Yeah, that was there's a couple studies out on that. That was I guess probably a reasonable thought. It just hasn't proven out to have an ill effect, the elevated CO2 levels that from the mask. So the research that I've seen has not shown it to have adverse effects on people wearing them. So it's a reasonable concern, but it just hasn't proved out that way yet.
Got it. Question here for Loren and/or Dustin. This is from Monica. What if a teacher is at risk or has a family member that is at extremely high risk? That's the end of the question, but I would gather the remainder of that might be something like, what precautions would you guys put in place for that? Or if somebody's in that scenario, what does the school district do?
Yeah, I can take that. So, we're small enough, we can deal with those kinds of things on a case-by-case basis. So last year, under the Federal CARES Act, anybody who was in that situation that's mentioned in that question had a work-at-home option just under the federal law, and nobody came forward with that. So we haven't had to deal with that. Were that to become the case, we would deal with that on a case-by-case basis. And that'll be discussed tomorrow as well. And Lauren, you can feel free to add.
No, I think that's right. I mean, what we've done is encourage as much vaccination as possible, to protect faculty and staff, and made that as freely available as possible. And if there's some special situation where that wasn't an option for a person, we would address it as Dustin said.
Got it. Thank you, gentlemen. I think we've got one last question from the audience here. This is from Eric for Jason. Jason, where do you see COVID a year from today?
This is me guessing, right? He said, where do I'm looking into the future, right? Mm-hmm. So I'll take certain liberties. I think that I think the virus is going to do what viruses do. And by that, I mean, they're going to mutate. There's going to be different strains. It's going to try to become more transmissible, but ultimately, I believe it'll move towards decreased mortality, less deadly is what I think. Not no deadly, but less deadly. And so I think it's going to drift into the background. I think it's with us for the long haul, though. I don't think it's going to wrap up and go away like SARS did and MERS. I actually originally thought that these highly infectious diseases with high mortality rates, also members of the coronavirus family, kind of flared up and died off, which is what I originally thought this was going to do about a year ago. But it turns out now that it's doing what it's doing, which is kind of behaving more typically for a virus, I think it's going to be around with us for quite some time. Now, part of that too is beneficial, because with increased exposure comes increased antibody production, and we will develop a certain amount of immunity, at least to severe infection.
Yeah, sure thing. Yeah, it's been a hell of a ride, I think, for everybody, and really appreciate everyone's insight on this panel. Grace, patience, empathy. None of these attributes politicizes an ongoing pandemic. We must all continue to follow the science, to think critically, to care for each other. We've all witnessed an incredible display of grace, patience, and empathy over the past year and a half. We've also seen what the other side can look like: dissonance, disinformation, anger. We have a choice for how we can act and react. A colleague and a good friend of mine recently put it this way: you can choose to get demolished by an ocean swell, or you can choose to ride the wave. Robert Louis Stevenson called it being loose in the saddle. It's not that we always have control over everything, as we've seen since the start of this pandemic. It's that we can choose, how to react to it. I want to thank our sponsors, Outlaw Partners and Low Mountain Land Company, and our audience. And to my distinguished panelists, thank you for taking the time to share your thoughts tonight. It was incredibly insightful, and it was a great conversation. Really appreciate you guys taking the time.
Anytime, Joe. Thanks for having me.
Thanks, Joe.
Thank you, Joe. Thank you, other panelists.
Thank you.
I'm Joe O'Connor with EBS Newspaper, and this has been the Big Sky Town Hall Series. Stay safe, stay curious, and stay informed. Have a good evening.